Hi, I'm Dr. Philip McMillan, and thank you for joining me again on this Saturday. And essentially, what I'm doing today is I'm having a quick chat with Joachim Gerlach because we're preparing for our upcoming conference, which is on the 26th and 27th of August. And essentially, we just wanted to chat through a few of the speakers just to highlight what is likely to be involved. And so straight away, I will get Joachim in, and so we'll get us together. Hi, Joachim. How are you? Oh, sorry, I have you muted here a minute. Go again.
Yes, good evening, Philip, and hello, everybody. It's a pleasure to
Ex-
be on again.
Excellent, excellent. And Joachim, just so, as usual, just so people know who you are, I just want you to do a very quick introduction of yourself.
Yes, I'm Joachim Gerlach. I'm head of research and development at Medicinals and also a founding member of the Long COVID Coalition. I'm a COVID-19 researcher and scientist. I've published already quite a lot of papers now on the topic, and we are working in several collaboration groups around the globe since the first day of the pandemic and trying to find solutions, understanding the disease, and provide patients with and doctors with more knowledge and intervention possibilities.
Excellent. Yeah. And just for people who don't know, so I've been working and interacting with Joachim for easily maybe 2 years now. And what's interesting about Joachim and at the time Prakash was the fact that both of them are engineers. So they have taken their engineering systematic approach to looking at problems into COVID. And I think that the kind of work and research Joachim has been doing has been quite phenomenal. Even the fact that he has been so consistent with getting in contact with people. That seems to be your great strength, Joachim. What is it? Do you email people randomly? How do you get in contact with so many people across the world?
Yes, I follow their work, and when I find that their work is really a significant contribution to the field, then I email them or call them to try to find their phone number, or maybe through other colleagues that are in contact with them. So I establish contact and try to see if they want to collaborate with us, which mostly succeeds. So now the group we have now is really interesting.
Excellent, excellent, excellent. So, when we think about what we're doing in the next few weeks, we'll be bringing together a number of speakers from different parts of the world. And what I wanted to do, Joachim, is just chat through who we have coming up in the next few weeks or months. So, let's start off with one of my favorites, good old fashioned Dr. Shankara Chetty. So yes, tell me what are your thoughts quickly on Dr. Shetty?
I mean, unbelievable. Yeah, we've been in contact together, you and me and Shankara, for many years now. And what he has brought to the field, in especially in the long acute COVID treatment, and the his discovery that this is for a big part, at least in the patients that turn severe, that it's a hypersensitivity reaction and can be treated as such. And then the sheer ignorance of the medical community not to adapt this method widespread is what brought us together initially. But he's a very fine human being and a very bright, a beautiful mind, so to speak. And good to have him in our collaboration. And we communicate on a weekly basis and even daily basis.
Yes, excellent. Yeah, I agree. I mean, Shankara for me is inspiring. Every time I talk to him, offline, online, he says something quite remarkable. You
Mm.
know, it's just the way his mind works that is incredible. So yeah, so Dr. Chetty will be here and he will be talking about both the perspective post-vax, post-COVID kind of picture. And George, and let me just highlight something here. A lot of people are thinking that this is largely over, no further problems. What are your personal thoughts?
Yeah, it's a dual approach. So we have to first to understand what this, let's say, incapacitating agent is doing to us, and as Kevin McCurn is phrasing it. So understanding what we are dealing with is essential if you want to find solutions. And we are still not there. We are still having some black spots in the on the map. So that is one thing that we want to proceed in doing with, and especially with that conference, show what we have been learning over the past year. And then on the other hand, what kind of interventions are now coming out of this understanding, and which have been already proven to work. So that is pretty much why we want to do this. I mean, I don't know if you have time. I can explain. We are looking. I call it the four horsemen of the apocalypse. What we are facing at the moment. Speaking, comparing it like that. So you have the myocardial, cardiovascular, thrombotic disease, and all the myocarditis, pericarditis, and all the, let's say, endothelitis, the cardiovascular system being hit very hard and showing in a lot of death and disease that this is one of the prime columns of disease. The second one is, of course, the neurodegenerative diseases, and in the brain and central nervous system. Then we have the immunodeficiency and autoimmune disease resulting, and as the fourth horseman, I would say cancer very clearly. So that is, let's say, the main topics we want to look at. How do they come about? What can be done? How can they be diagnosed? And what are interventions that can prevent them from disease progression and or even reverse it?
Yeah, and so that leads us right into speaker number 2, Charles Rixey. Who is Charles?
I've been following Charles actually throughout the whole, I don't know, almost the whole pandemic. Charles is a former Navy SEAL and expert on biowarfare, defense. He's coming from that sector, and he, as also I did right from the beginning, went into looking into the laboratory origin and what has been done to this virus, so-called gain of function research. But in our group, we stayed away from that in public because it was an uncomfortable topic, so to speak. And now, as this is coming more and more to the attention of mainstream and to people, that it might not be originating from a fish market and from a zoonotic event, we might want to have a closer look. And that is Charles' role now. What are the sequences included into the spike and into the virus, and what kind of disease what kind of disease they're causing? So that is really essential. Again, know your enemy. So we are right in the middle of that with Charles.
So yeah, it raises an important point. In case people are not aware, at the moment there are a lot of tweets and charges flying around about the fact that this was known, this virus was being worked on or something similar in the Wuhan lab, and the reason why the lab leak concept was suppressed. And so this is pretty serious stuff. And what is remarkable is that it seems that a lot of the general public are just overlooking this point. I mean, I can just warn people, if that happens and people get away with it, I guarantee you it's likely that they're going to try it again. So I think that would be very, very interesting to see. Well, let's move on to one of the other speakers here. We've got here Stephanie Seneff. What can you tell us about Stephanie?
What a lady. Look, Stephanie and I met already a long time before COVID, because she was advocating for children and people that were hit by chronic disease, mainly through herbicides and pesticides like glyphosate. So her campaign and also publications and scientific work on what glyphosate can do to the population is unprecedented. And she was going through hell, being discredited and criticized. And yeah, like we see also now with COVID, pretty much the same. And in the end, she was proven right with the Monsanto trials and the big fines that this company had to pay. And everything that she published before was kind of confirmed at these trials. And so I worked with her before that on how to mitigate the glyphosate damage in the population. And when COVID hit, we both jumped at it immediately. And look, we saw that that's going to be a big one. So we better do something about that. So she's been around and with us since a long time. She's a real angel, scientifically
Yeah.
also.
I'd interviewed her some time ago, and again about the glyphosate. And as you say, her thinking again is so detailed, so thorough. You know, the last time, just when we had a preemptive meeting, she said something just casually about the thymus that just immediately triggered my research. I immediately started to type it down because she just incredible thinker and researcher. So yes, it'll be really interesting to hear her perspectives. And just to remind people, that you better be prepared to watch this live, because some of the stuff they say I may not be able to keep on mainstream social media. And so, if you want an honest, scientific, open discussion, you have to watch it live, because I may have to take it down depending on how open and honest they are. But this that is a challenge that is in front of us. Okay, what about our next speaker here? We have here Christie Grace. What can you tell us about Christie?
I don't know her that long, but she is in the team of Charles Rixey and Kevin McCurn. And so her expertise, she comes from the biotech industry, and she's an expert on lipid nanoparticles, mRNA therapeutics, not COVID, but before these kind of mRNA interventions were already used on very rare diseases. So she has done a lot of research on what should we look at if we look at the lipid nanoparticles and the mRNA and the plasmids. And she's an expert also in CRISPR technology. So we want to listen to her for sure, I can promise you.
I think it's important, that I think hearing from somebody who has expertise with regards to lipid nanoparticles, because as I said to someone before, I think I recently said it to Headley Rees, I think that the technology and the platform may have some benefit, but I think they picked the wrong disease to test it out on. And the question is, can the technology survive the fallout from the pandemic? Will it be given an opportunity if this is turning out to be, an unmitigated disaster, which a lot of are predicting? Can it survive what happens? It's almost equivalent to what happened to thalidomide. Thalidomide is a good drug. Just don't use it in pregnant women. That's the reality. It's a good drug, just don't use it in pregnant women. And we may see something similar. And so it would be interesting to hear Christie's views. Next in line, we have Professor Hans Rausch. Who is he?
Yeah, it was like a reinforcement from our side of the development of plant-based phytopharmaceutical or dietary supplement compounds. And so he's one of the most renowned, there's only a handful of people of his caliber in the world, one of the most renowned experts on phytocompounds and their use. So he's very one of the highest ranking experts on traditional Chinese medicine, Korean medicine, Ayurveda, plus he has a complete pharmacological background. That means he knows exactly how each single compound will work out and or in combination, and he makes these products really work. So he has been standing behind me with a whip the whole time in the labs for the last 8 months, overhauling our products and making some new products. So now I can really from deeply in my heart say we did everything possible to make these compounds as bioavailable and as efficient as it's possible. With him, that's doable.
Yeah, so I mean, yes, that's actually one of the big areas from the pandemic that I think is going to have massive growth, is the fact that, again, I think the pharmaceutical industry has shot themselves in the foot, and the fallout from public perception because of the way how the pandemic was handled is going to impact many other drugs. Unfairly so, in the sense that the drugs may be fine, but the industry would have lost faith. And so it gives a really big opening for natural products and naturopathic systems to come to the fore again, which is a good thing, in that they should always have been having equal place with any pharmaceutical therapies. So moving right along, our next speaker is Rachel Jessey. What can you tell us about Rachel?
Within the team, if it comes to nutrition, if it comes to biochemistry, if it comes to neurological, neurochemistry pathways in the brain, mitochondrial health, gut health, and all these topics that are very important as to really get people back into a, let's say, into a healthy state, then there's not many people like Rachel. I always say that she's the brightest candle on the cake in the team when it comes to this. And she's been also stopping me and criticizing a lot of interventions from the past. She said, no, you can't do that because this and this will happen. It will push off another pathway. So her knowledge as a nutritionist and as an expert for for biochemistry is really amazing, and she's so much of value in this team. In research, she's publishing with us, so she's in the inner circle of collaboration. Really a fantastic therapist.
Yeah, so I have interviewed Rachel in the past as well, one-on-one. I agree with you. Some of the information she has about the importance of the gut microbiome, how to protect it, how to rebuild it, is absolutely critical at this point, especially because so much of the disease that is likely to occur is going to be driven from the gut. So yes, so I agree with you that tremendous to have her involved as usual. So, yes, moving right along, another one of our celebrities here, we have Dr. Mannan Baig from Pakistan. What can you say about Mannan?
Mannan is my scientific wingman, and also just by itself, he is one of the most brilliant neuroscientists and medical doctors involved in COVID. And I think the most cited publication comes from him, especially on the early warning in 2020 that the SARS-CoV-2 and the spike will cause permanent neurodegenerative diseases. And I think he was unfortunately proven right with that. So we are constantly collaborating, publishing together, and doing lab work. He's involved with us in India, and he's going to move, or he's already moved now to Germany to work in the clinic with Dr. Beate Jaeger in the laboratory and help her also with the patients. Amazing.
Yeah, so I've had the pleasure of talking to Manan at many of our conferences, and his expertise in the neurosciences and the neuro-COVID side has been tremendously valuable. Actually, he was the one who, in the last discussion, was talking to me about the fact that they had adjusted the mRNA with the proline. And interestingly, I just done a presentation on it. I think that this has an impact on that spike protein to make it more insoluble for the immune system to deal with. So just an interesting point. But as you said, another great researcher who has been tireless in his work across the world. Okay, so let's move on. We have as well Dr. Tina Pierce from the UK.
Yeah, who doesn't know Dr. Tina Pierce? What a warm-hearted and empathic woman, again, fully in the patient's interest, and amazing how she, in the very early stage, already identified and treated the histamine problems and the mast cell activation, same like Shankara. So her and Shankara are very close in their intervention and interventional approach on this disease, and invaluable. So I love to work with her, and we are also doing a lot of common projects together in the UK. So it's a big pleasure to have her on this conference.
Yes, and again, she was part of our first conference, and I think I had to go back to her presentation. It was so accurate with regards to the mast cell activation and the way how that works. So again, another tremendous clinician. It's important for people to remember that these people are working tirelessly in the background to try and find solutions for patients, to understand the science and the research, and they're not heard much, and it therefore appears that all the people who are on the news know what they're talking about. Follow the people who haven't made any errors in terms of the direction and the trajectory of the pandemic. That's the advice that I give to people. All right, so moving right along, we have here Dr. Carlo Brogna from Italy. He'll also be participating. What can you tell us about Carlo?
Incredible, groundbreaking discovery he made that the SARS-CoV-2 virus is like displaying a bacteriophage behavior, meaning that it infects our own bacteria in the gut and elsewhere in the body. So this has huge implications in the disease expression, and it's affecting many patients because viral persistence, toxic peptides in the bloodstream. So he has documented all that and proven it. So there's no doubt he could prove it under the microscope. He could prove it in cell cultures and on patients, and he also is good as a medical doctor to treat this problem accordingly. So he was a huge benefit for our group.
Yes, I have spoken to Carlo as well, and he was another one that I think that highlighted something critical with regards to the bacteriophage property of the spike protein. And again, this one is so big. It took me almost a year of reflection to come all the way back to this, to realize that this is probably one of the fundamental tenets of the long-term issues that patients are having across the world. So again, brilliant research, something that we really have to look out for. What about Dr. Robin Rose?
Yeah, Robin is our partner in the US, and we are so happy that we could come together with her, because she is like a one of the most brilliant integrative medics that you can ever imagine, looking again, like also like Rachel and others, into the biome and also into all the different pathways that lead to these post-vac or long COVID conditions. And she's practically working with many patients. She's a member in the FLCCC, and now we are building some, how can you say, like spaces where you can buy ready to go protocols, like common denominator protocols, spike detox protocols, neuro COVID protocols. So we are working on that on the way in each aspect you want to look at, from the diagnostics all the way to treatment. So she's a big asset, especially in the US now.
Yes, I don't think I've spoken to Robin before, so I'll be interested to hear some of what she says from a research point of view. So, again, it's always fascinating to hear the work that has been done. Just a reminder for everybody, August 26th and 27th at 6 p.m. So, it's 2 days of conferences, because there are that many speakers and there's that much research to cover. And make sure you're live, because we don't know if this will survive in mainstream. So, yes, moving right along, then we have just a few more speakers to go. What can you tell us about Professor Beate Jaeger?
Uh, she's bad news for the wheelchair industry. So, if you want to see one of the most successful doctors in treatment of long COVID and post-vac, then of course her system that she's implementing, the so-called help apheresis with extracorporeal cleansing and addition of heparin, is really one of the few things where I've seen extremely injured patients become better and even get out of their wheelchairs, and not only a few. And so we are collaborating with her now full time. That means we are in Germany, where Mannan is now at her clinic. And we are so happy, because she's also really open for additional protocols that will support the help apheresis. And now we are having the chance to document all the work she has done so far. She's only treating patients 24/7, and it's mostly children also. So she doesn't have time to do all the publications. And so the lab work and the work with me and Manan will, with her together, will hopefully advance this again to the next level.
Yeah, and I think that somebody just said this a while ago, and I think that this is such an important point. International dialogue, having all these experts across the world, and I think, Joachim, you've been central to that, reaching out to people, pulling people together, trying to get them to collaborate. And I don't think people realize just how much you are bringing from an engineering background in learning how to collaborate and bring people together. So yes, I think that that's where the answers will be found. That the more collaboration we have, the faster and better the solutions are going to be. And so, moving on to our last speaker here, we have Kevin Mccairn. What can you tell us about Kevin?
Now, Kevin has also been looking deeply into the lab origin and into whatever constructed sequences are to be found in the spike protein and in the virus. And his field, of course, is an expert in neurosciences, and has done, I think, decades of work on primates, especially on Parkinson's and other neurodegenerative diseases. So he could look at the living animals' brains and see what happened with the amyloid beta and tau proteins and other aggregations, and how can that be treated. And so I'm really happy that we have somebody of his caliber now in our circle of collaboration to try to find out what is really going on. It's still not clear yet if how bad it is. So that it's ongoing, we know, but we don't know how bad is it really.
Yes, yes, yes. I'll be fascinated to hear him as well. I don't think I've spoken to him before. So again, you always learn something new with each speaker. So great to do this review, reminding everyone that it is on the 26th and 27th of August. It will be live streamed on a number of platforms, including YouTube, Facebook, Twitter, LinkedIn, if you're interested, and they'll be talking about some of the hard hitting points that need to be covered during that time. So make sure you listen to it live, because you know what it's like these days with regards to this kind of information remaining up. I just wanted to quickly, just before we finish, I just wanted to tackle a point here. This is from Red November. Long COVID. I thought that was lies to cover the shot. Any response to that, Joachim?
Yeah, look, we should be very careful not to fall for one side or the other exclusively in the narratives. We have seen millions of long COVID patients before the vaccine was even rolled out. So it cannot be a cover up. Of course, now in the retrospective perspective, now any kind of damage that happens can now be also attributed to additional long COVID cases and not vaccines. So it's very difficult to distinguish between them. It can be done right now. There are some, Kevin McCurn has, Kernan has identified some methods how to distinguish between spike and wild type, natural synthetic spike and wild type. But in the end, who is there having only one problem? Most people were vaccinated and had COVID. So, in my opinion, both is bad. You want neither.
Yeah, that's a very important point. And so, as a takeaway, I would like to remind the people of something. Just in the same way as electricity, it doesn't care what your opinion is. Don't touch the electric fence because you're going to get shocked. The same way, this COVID pandemic, the science doesn't really care about your opinion. All you have to do is follow in detail exactly what is happening every time it transitions and try and find solutions for it. As far as I'm concerned, the next phase of the pandemic is just about to start. And here is a lesson from history. In the first wave of the flu pandemic in 1918, I think there were 2 million deaths. In the second wave, there were 50 million deaths. Just be prepared. Let's focus on the science and let's not drop our guard, because there is still a long way to go. Any final thoughts, Joachim?
Yes, for sure. Maybe one thing, when we were preparing for this conference, I said back when we had these discussions with all the speakers about what we can say and what we cannot say and what might become censored because you shouldn't talk about this and that. And it kind of struck me, we in Germany, we had two totalitarian regimes in the last 100 years. And that is exactly how my fathers and also my uncles and other family members later in the communist part of Germany had to behave. And I thought, like, where are we right now? That in our countries, we have to be talking on a scientific discussion about what we may say and what we shouldn't say. Maybe some food for thoughts. And in this conference, we will talk about the things that we think should be talked about. And we don't care about politics and censorship so much, because if it is relevant, we have to mention it. And if it's a scientific finding, why not talk about it?
Excellent point. Thank you. And so, just a final reminder, these are our speakers, and they will be there on the 26th and 27th at 6 p.m. UK time. It is a free conference, so that means anybody can watch it, but it may not survive beyond that live thing. So, make sure you watch it live. And just quickly rolling through our speakers, Dr. Shankara Chetty, Charles Rixey from the USA. We have Stephanie Seneff from Hawaii. We have Christie Grace from the USA. We have Professor Hans Rausch from Germany. We have Rachel Jessey from the UK. Mannan Baig, Dr. Mannan Baig from Pakistan. Dr. Tina Pears from the UK. Dr. Carlo Brogna from Italy. We have Dr. Robin Rose from the USA. We have Professor Beate Jaeger from Germany. and we have Kevin Mccairn from the USA. So
No,
those
Tokyo.
Tokyo. Oh, yes, Tokyo, not the USA. And so those are our speakers, and those are the people that we'll have in the next few weeks. I'll keep on raising the awareness of it. Make sure to look out for it. And thank you again, Joachim, for being here. And we'll be in contact soon. Have a great evening, everyone, and we'll keep you updated.
Thank you. Thank you, Philip, and goodbye.
All right.